Hello, this is Suzanne Craw, Assistant Director of Pupil Services, and I'm with Tara Webb, our co-head nurse. Today's topic is, Should I Come to Work? A review of COVID-19 scenarios. We again want to thank you for your review of our health and safety manual, but we really do have another message for you, a follow-up message. Should I come to work? We need your help. Help us keep everyone healthy at Windham Public Schools. If you're sick, please stay home. If you become sick during your workday, tell your school nurse and your direct supervisor and go home. Communicating with your school nurse is critical. The best way for us to minimize the spread of illness is not to be around others when we are ill. You have a really important job, and when you're at work, we know it goes smoothly. But coming to work when you're sick is still not an option. Be informed, know the key symptoms.
So here in Connecticut, the Department of Public Health is focusing on 5 key COVID-19 symptoms. And those symptoms are feeling feverish, measuring a temperature of 100.4 degrees Fahrenheit or higher, a loss of taste or smell, shortness of breath, difficulty breathing, chills, and or a new uncontrolled cough. If you have a pre-existing medical condition such as asthma that causes shortness of breath that doesn't impact your ability to perform your job, then it is not a symptom that would exclude you from work for COVID-19. If you're experiencing any of the symptoms listed on this table, then you cannot come to work. And in addition to calling out, you should contact your school nurse.
We are asking each student, parent, and or staff to complete this questionnaire each day before attending work and or school. This form is found in the Health and Safety Manual.
So let's review the difference between isolation and quarantine before we go on to the different scenarios. A person would go into isolation when they are diagnosed with COVID-19. A person will be asked to quarantine when they have been exposed to someone who has tested positive for COVID-19. Travel restrictions may also require a person to quarantine. I have received many questions about why quarantine is longer than isolation. It seems as if you are sick, you should be out of work longer than if you've just been exposed. Isolation for COVID-19 is 10 days because that is how long you are able to infect someone else and potentially make them sick. After coming into contact with a person positive for COVID-19, it can take up to 14 days for your body to experience symptoms or test positive for COVID-19. If any time during your quarantine you become positive, you will then start your isolation period of 10 days to be sure you don't get anyone else infected.
Tara, I think the next step would be for us to review some scenarios with staff. Scenario 1. You are not feeling well and have congestion. You have no other symptoms. You have had no close contact to a person diagnosed with COVID-19 within the last 14 days. Should a staff member or student self-quarantine or self-isolate?
They don't have to do either of those. The symptoms are not any of the 5 key COVID-19 symptoms, and you've had no close contact with a person diagnosed with COVID-19 within the last 14 days. If you are feeling too unwell to be at work, then we do encourage you to use your sick time and remain home until you're feeling better.
I do think it's important to note that if they do stay home, they should contact their school nurse and their direct supervisor. It's really important that we track these symptoms, and this applies even if you're a contract employee. All right, scenario 2. I really love these scenarios. You are feeling feverish and you have a temperature of 100.4 degrees. You've had no close contact with a person diagnosed with COVID-19. Should a person self-quarantine or self-isolate?
I'm sure you've all guessed it. It's self-isolate. You should self-isolate for those 10 days and remain fever-free for 24 hours without fever-reducing medication and see improvement in any other symptoms you may have. You have one of the 5 key COVID-19 symptoms, so it is really important that you stay home. We encourage you to get a COVID-19 test and report any test findings to your school nurse. If your test is negative, then you may return before the 10 days, as long as you still are fever-free without that fever-reducing medication, and you can provide documentation of your negative test result.
I think it's important again to reiterate that if you're self-isolating, you definitely need to report this to the school nurse and your direct supervisor, even if you're a contract employee. And even more important, our school nurses will help you with HR. Scenario 3. You report to the nurse you are experiencing shortness of breath, but you have asthma. You have no additional complaints and have no other symptoms. Your temperature is taken and it's 99 degrees. You've had no close contact to a person diagnosed with COVID-19. Does the person have to self-quarantine or self-isolate?
They don't have to do either of those things. If your shortness of breath is related to a known medical condition, in this case asthma, and you have no other symptoms, a temperature of 99 degrees is not considered a fever, by the way. If at work, you can enter the health office and you can use your inhaler and hopefully those symptoms improve. If you're still not feeling better within a short period of time, or you don't think that you're able to do your job, then I would encourage you to go home and use your sick time and return to work when you're feeling better.
And again, if you decide to stay home, go home that day, just make sure your school nurse is aware and or your direct supervisor. Scenario 4. You're not feeling well and you have congestion, a sore throat, and a headache. But in this scenario, you've had close contact with a person with confirmed COVID-19 within the past 14 days. Do you need to self-quarantine or self-isolate?
So here we're going to ask you to self-quarantine. You should remain home to quarantine for 14 days from your last date of contact with that positive COVID-19 individual. We're asking you to self-quarantine because you do not exhibit any of the key COVID-19 symptoms. If you do choose to get tested and you test negative, you will remain in self-quarantine for those 14 days. But if you test positive, you will then remain in self-isolation for 10 days from the date of that test.
And again, if you're asked to self-quarantine, this needs to be reported to your school nurse, even if you're a contract employee, and your direct supervisor. Scenario 5. You have no symptoms. You feel fine. You're ready to come to work. But you know you've had close contact with a person with confirmed COVID-19 within the past 14 days. Do I really need to self-quarantine or self-isolate?
You sure do need to self-quarantine. You should be home to self-quarantine for 14 days since the last known exposure to that person diagnosed with COVID-19. And we're also going to ask you to monitor your symptoms. If you're unable to avoid the additional contact with that positive individual, maybe they're your spouse or your child, then your quarantine will not begin until they are no longer contagious. That is, after their 10 days of isolation are complete, you may begin your 14 days of quarantine. And also just to note that self-quarantine means that you're staying home. It's not just being quarantined from coming to work. We're also asking you to quarantine from the community. So you're not going to be running those trips to Walmart. You're not going to go run out for that quick patio dinner with a friend. We really are asking you to stay home when you're in self-quarantine.
And I think I'm starting to sound like a broken record. If you have contact with someone with a positive case of COVID and you have to stay home and self-quarantine, we want you to talk to your school nurse. It is incredibly important that we have this information and that we are documenting this along with your direct supervisor. Again, we thank you for hearing us today. We need you to help us. Remember, if you're sick, please stay home. And when you're at work, continue to practice those mitigating factors, the wearing of the face masks, sometimes those face shields, social distancing, hand washing and hand sanitizing, cleaning and disinfecting, and limiting material sharing. We thank you all. Have a great day.